Call our meeting to order. It's Board of Health Program Policy and Appeals meeting for July 15th, 2026 at 8:30. How about a roll?
Commissioner Leninger?
Here.
Commissioner Draper? Commissioner Stoll?
Present. All right, so moving on, we're up to the approval of the agenda.
I would move to approve the agenda as presented.
I will support that. All those in favor say aye.
Aye.
Aye. Motion carries. I guess I'll have to vote too. I don't know. It's kind of weird sitting in the chair spot.
I know. But yes, Robert rules of order, typically the chair doesn't vote except to break a tie. But in a government body, the chair always votes, because the chair is a part of the body.
Right. Yes. Yes. All right. We're up to public comment. I don't see any public, but we'll still put the call out there. All right. Moving on to unfinished business. We have our procurement policy.
Teresa's gonna cover that.
Okay.
Primarily adding the stuff in red on page 5.
Yes. And that, those are requirements, that were discovered during our, vote on it. That those items were identified as things that are needed to be added
Okay.
for the change to the language and.
Why is it VOSB? Where does the S come from?
I don't know.
Small business, maybe.
But it's veteran-owned business.
Yeah, I see that, but I'm just speculating on maybe what they're thinking it should be.
I wondered the same thing when I copied it out of the.
But that is straight from the language that's needed.
I would move that we recommend the adoption of the updated procurement policy to the full board.
I support that. We have a motion to support. Is there any discussion on that? Questions you think? I don't either, really. If it's necessary language, I think we're probably good.
The only thing, I still think we ought to require higher liability insurance for contractors.
Yeah, we did touch on that. Okay. All those in favor say aye.
Aye.
Aye. Any opposed? All right, motion carries. We're up to new business, community health needs assessment.
I'll take this one.
Okay.
So you'll remember not too long ago, we asked you to allow us to hire a consultant to help us produce a Branch County community health needs assessment, a community health improvement plan for all 3 counties, and finally, a strategic plan for the agency. And so this is the first piece of that work. Branch County had not had a community health needs assessment completed since, I don't remember what year, 22, I think. So they were overdue. The hospital had recently changed ownership and they weren't ready to get engaged. So we felt we couldn't wait any longer. So we went forward and did this. So this project involved key informant interviews, the Branch County Community Network. They were also asked for information on what the needs are, the health department itself, and then a survey document. All that information was gathered to produce this, to identify what the needs are. And then we went the next step and prioritize those needs. So this information, now that we have it, is very similar to what we see in St. Joe and Hillsdale. Those community health needs assessments were done with the hospital systems, but they all tend to kind of identify some of the same issues: access to care, maternal, infant, child health, and in our case, the third, substance abuse. A lot of them use mental health as, the hospital systems tend to use mental health as one of their key components. Where in Branch County, we focused it in on substance abuse. That's what we were hearing mostly from partners was concern, a lot of concern over youth and youth use, vaping and, like they're just kind of doing everything. They don't see the harm in trying and then, maybe continue use. So those were the three things that, that this community health needs assessment ended up focusing on. They were the top three. You can see that information on pages 28 through 31. And then we just shared all the appendices, which is the data that was collected. So it's a good report. It was a lot of work on the part of our consultant, a student intern that also worked alongside the consultant, and our own staff, primarily health education. Chris and her staff pulling all the data, getting it together so that we could use it to help inform. And I'm glad that we can move on to the chip.
Yeah, the one thing that stood out to me,
Mhm.
and then is it's on page 14.
14, I'm way too far. Okay,
Vacant housing units, 12.1%. You hear all the talk about,
Yeah.
shortage of housing. Now, when you go up and you read at the top of that page, it says some of that is, are due to unoccupied, which would be due to, seasonal housing.
I think
But-
you'd be surprised how much seasonal.
Well,
is
I think
because
there's
of the
quite a bit.
lakes.
Well, we have a lot of that, but I said it's just, why do we have a housing problem when we have,
Mhm.
and again, it's too bad that some of that, you can't take those seasonal homes out of that and just
Right.
look at,
Mhm.
what homes are truly unoccupied, because those are occupied part of the time.
Well, they might be Airbnbs or, but I'm guilty of this, right? I have a seasonal home. And it does make an impact on the housing market. All the people that own a second home and either Airbnb it or just use it, occasionally, makes an impact. So,
Right. The other thing is I guess the value of the home too, whether that's within reach for somebody,
well, that's a huge thing too.
Yeah.
Yeah, I mean, if you look at houses and what.
Yeah, well, the median, they've got it right there on that same page, median value of owner occupied homes is 142.4.
Yeah. And I'll bet a lot of them are much more than that.
Well, that's the median.
Well, right, exactly. But some are less, but
But just looking at, what's like listed for sale right now.
Oh.
I mean, there's not much that's,
You can't get anything for under 200,000.
yes, you're right.
exactly.
Anything more than
Yes, that you can actually live in, right?
I mean, you're certainly not getting any property, so you might get a city lot
Yeah,
with an old house that needs a lot of work.
right.
But
Okay, do we need to recommend this to the,
yeah, so what we're looking for is for the board to accept this document. And you'll notice at the front, there will be, right on page 7, that the Board of Health, it says approved, we can change that word or use approved on whatever date that action happened.
okay,
So,
I would move that we recommend the full board approve the community health needs assessment as presented.
okay, I'll support that. Is there any discussion? I think you're right on or spot on with the substance abuse issue. When I talked to them, we discussed that, but also just the mental health connection to it. And I'm looking at page 17 here. And then that's kind of what that talks about, right? I mean, it's just, those two things really go hand in hand,
They do.
right?
Yeah.
So I think people are kind of like, I guess, self-medicating, their mental illness, as opposed to getting the treatment that they need.
There's times I do that with maple syrup. In the process of making such maple syrup.
Sure. Well, fortunately, that's not an illicit or illegal substance. So,
Well, there are medications that are very easy to get a hold of today that were a
Yes.
little less easy not too long ago. And people are choosing to self-medicate.
yeah. Yes.
So,
But I think a lot of that substance abuse or use, I should say, is connected there still. So, and then access. Yeah, you mentioned that. I clearly, I mean, we just as we were talking before the meeting started, in the St. Joe County area or Sturgis area, especially, it's going to be a challenge. I think.
Yeah.
I mean, this is clearly Branch County, but possibly affecting people on kind of the west part of the county as well. So,
people that live in our area are not accustomed to not having those services available
yeah, I agree
close
with that.
by.
Yeah.
Um,
I mean,
So,
at
yeah.
this day and age, especially, people they're used to traveling for
Mhm.
specialty services.
Yeah.
I think basic care, though, and emergent care
Yeah.
are the big challenges. People, they expect those to be close.
yeah,
So
they do. There are other areas of the United States that if they went there, they'd be surprised at how far they had to drive to get to care. But
sure,
Well,
sure.
Go to your seasonal home. Tell me how far you have to drive to get to care.
exactly.
Right.
Yeah.
Okay. All right. Any questions you have? Right?
No.
All right. All those in favor say aye.
Uh,
Aye. Motion carries. Okay, we're up to health officer evaluation policy.
That time again.
Yeah, so I threw this in here. It needs a small change. The last paragraph there, we took that merit pay out of her contract, so that needs to be struck from this policy. Didn't know if you wanted.
well, but do we? Because we may award merit pay for the negotiated contract.
So if it's just not there, it's
If it's not there, I don't know if it's a problem. Just a quick thought about that,
yeah, you may institute that again in another contract down the road.
Right.
That makes sense. I'm good with that.
It does. Yeah, I agree with that too.
I like
So
it.
try not to overread it,
Does not apply. Check.
Okay, so we are good with keeping it the same.
I think, yeah. The other thing that we may want to say is, or we may want to change this in the second paragraph or second sentence.
At the bottom, you mean, or where?
Yeah, in
Okay.
that word
Merit
deals
pay
with,
that we voted on in the September meeting.
right,
Yeah.
and we may say, we may want to change that to if merit pay
It's part of the
is
contract.
part of the contract, it shall be voted on at the September. But, let me think, was that spelled out in the contract when that was paid?
No,
It was just part of the evaluation process.
yeah.
I think.
Okay. I couldn't remember if it said in the contract when that merit pay was paid or not, or if that was,
On a satisfactory evaluation. So,
It- I asked for that language of the September to be put in there so that it made sure it went into the fiscal year that it was being.
That's kind of what I figured, yeah.
or the merit pay, if payable, shall be voted on because again,
So you want to add something at the beginning.
right, you know, in that sentence, because,
Payable, merit payable shall be voted on the September meeting.
yeah,
That makes sense.
I would move to recommend that change to the full board.
Support that. Any further discussion on this? Hearing none, all those in favor, aye?
Aye.
Aye. Motion carries. Okay, we're up to employee satisfaction survey results.
Every year, we run the survey through the staff, same questions this year as last, no changes. There were changes, I think the year before, but at this point, we use the same survey tool. And you can see, it's, you know, Teresa color codes it green and based on improvement from the previous year or decline. So there's a little bit of everything in here. There's some improvement, there's some declines. A lot of comments then that follow on page 57. I always kind of like to read those because I think they can be a better indicator sometimes than just a score. The other thing I would say about the 2026 survey is we only had 44 staff that completed it
Saw that.
versus 57 the year before. And I mean, you can only beg them so much.
Yeah.
Right? And we do. Multiple emails go out. Teresa sends those out. So it's not for lack of trying to get responses.
Yeah, I mean, that's and is there any way we can, I mean, somebody probably knows what employees have completed that. I don't know if you do, Becky, or not, or probably
No.
not.
Yeah.
Okay. But I was just wondering if there's any way that we could, well, we probably can't because it would probably violate government spending rules, but if we could, enter those employees that completed the survey into a drawing or something, you know,
Some kind of incentive.
yeah.
I guess you could ask them if
You
they
know,
want to put their name.
Yeah,
in
I
the
don't know
hat.
if there's a way at the end where you can say, if you complete the survey, you want to provide your name for a drawing where the survey results for
Still
every other
anonymous.
question go one way, and that last question, or that last answer goes someplace else. But I mean, then you would know who did it and who, you know, who didn't, but yeah.
Technologically, I'm not sure if I can make that happen. But also, I mean, if you look at the first couple of questions, we have a fair amount of people that are concerned about being identified. They don't even want to answer which
Yeah,
is their home office
I saw that too.
or
Yeah.
what division they,
That
because they're,
percentage is pretty high.
Yeah, because, you know, you've got very few identifying as being at Hillsdale.
Yeah.
You're right.
Mhm.
And
But
it's,
if you look at 25 though, too, Hillsdale was. fairly
yeah,
low as well.
that's consistent.
Mm. But there's a big jump, and I don't want to answer this question. So, it's what, 14%?
Well, I mean, of 44 respondents, we don't know, you know, because that's a percentage of those
Yeah,
that
you're right.
responded.
You're right. Yeah.
You know, had we had the other 13 people answer, you know, would have that percentage been,
Well, it would have been potentially more in line with the previous year,
Yeah.
How
but
many staff do we have?
70.
And that's 79%, 44.
78 would be.
Or is that last year's percentage?
Yeah, I'll probably have to look. Maybe I didn't update that.
Yeah, well,
56.
so
I'll investigate that because that wouldn't be 44 out of 78, wouldn't be 79%.
No.
Commissioner Stoll's doing math right now.
Yeah, it's
Let's see what it is.
56%.
56?
Mhm.
Yeah.
the 44 out of 78.
Well, and I'll make sure that it's 78 when this is actually open, because it might not have been 78 at that exact.
Yeah.
I'll update that.
Well,
I will
and-
say though, even a 56% response rate is still good, I think, overall.
When you count that 78, are you counting like the staff that, screeners, hearing and screeners for the school
Yeah,
that only
that-
work?
But they not looking at that time. And that's why I said I need to
I guess.
verify actually how many people were actually on.
But
working
do
at that
they
time.
get that survey as well, even though they may not be working?
They
when they-
don't.
See, and we need to change that, cause they should. Cause, I mean, they're,
We'd have to change the time. We'd have to move it up to April. We'd have to send this out in April. Because once we,
do they not have access to their agency email at all?
No, they're laid off.
When do you do this? What month does it get
We
sent
usually do
out?
this in
I mean, and in June, you've got the vector-borne staff here, whether they complete it or not, you know,
I suppose they would have gotten it.
but they are, you know, in their seasonal
Mhm.
workers, so they add to your 78 number.
Mhm. I mean, even the numbers that went down didn't move a lot.
It's small, right? I mean, but,
You're gonna,
you know, when you only have 44 in there
Exactly.
too, it makes a difference.
it does.
That's why I like to look at the comments.
I mean, the comments can help like dial in on what, if there is a specific area that
Yeah.
needs work, I guess.
So as you're looking at that, what we do with this is the supervisor, director, also all the administrative staff, we've taken a look at it. We will look at it further and determine a quality improvement project, that maybe we need to do on our side from that standpoint. And then we have an employee satisfaction committee that also will look at the survey results and determine what they can do to make positive changes that, you know, that work for the agency. So
And I take it we had some new questions then this year.
there weren't any names this year, were there?
It's like,
Well,
was at the end.
because like question 42,
Yeah, so the
No,
reason
so
there's no comparison there is because remember last year, this was an inverted scale on last year's survey. And
okay,
so we
Oh,
changed,
yeah.
because when it got to that point, 1 was better than 5, so we flipped the scale. And I did not want to manipulate data, so I deleted that from last year's because the scale was flipped.
then did we not, question 44, 45?
Those are
Okay,
the narratives.
those are narrative questions. That's
That's the pages that follow. 57 through.
And you can tell people are, you know, being affected by the economy, right? They're concerned about their pay, they're concerned about raises, they're concerned about, I don't know, they're just concerned.
And that topic came up a lot during the strategic plan too. Pay
Yeah,
benefits, pay
sure
benefits.
does.
Okay.
we don't need to take any action on this.
It's provided, in advance of the
In advance of your
evaluation.
evaluation.
Yep.
Another scheduled for September board meeting.
Yes.
Okay. I don't see any other new business listed. So we'll move on to our next public comment period. Haven't. So,
I'm disappointed I didn't get any cake this one.
Is it your birthday? Dang it. Happy birthday. We could sing.
Just another day.
What are you doing to celebrate your birthday? You-
Attending this meeting, going to work.
Well,
It's
that's
a normal day, isn't
That's
it?
good.
Being an adult is so much fun.
Yeah.
Carrying on.
Yeah. Another year older.
I would entertain a motion to
Move to
adjourn.
adjourn.
Support. Some favor. Aye.
Aye.
Aye. We are adjourned.
Yay.